Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to diagnose trigger finger. But before I do that, we need to understand what is trigger finger and the symptoms that you might experience with trigger finger. So first, we need to understand what is tendon. Tendon is a fibrous cords that attach from muscle to the bone. So you can see it here in this image. Actually, your tendon in your hands attached from here, your bone all the way going down, and it's actually going down all the way to your elbow, the flexor tendon. So tendon is a fibrous cords that attach muscle to bone or bone to muscle. So your flexor tendons attach from the knuckles of your fingers, and it's going all the way to your flexor muscles here that attach to your elbow. So the finger tendon is actually sheets that's actually very thick sheet, and you can see it here on those image in that image. And when you have trigger finger, it's usually inflammation and fibrotic tissue, which is actually scar tissue. And this is an image for the fibrotic tissue that shows internally. With trigger finger, you will notice like there's a swelling and actually scarring in this area in the tendon, and that will decrease the gliding of the tendon. So when you open and close your hands, it will not fully open, or it might open with click. So what is trigger finger? It's actually scarring and inflammation that decrease the tendon gliding and range of motion. And another image for the tendon here, and you could have it on any of those fingers. You could have it in one or two, or actually more than one finger. Some patient might have it in both hands. So typical symptoms for it is pain, stiffness, and sensation of locking, catching when bending or straightening your fingers. So very common symptoms that when patients start to straighten their finger, they actually stuck and it snap. So it takes them a while to loosen it up, or sometimes it actually snaps all the time when they open their fingers. So it's a nodular catching with locking, popping, and actually usually experience morning stiffness, and throughout the day start to loosen up. But with severe cases, you actually might have that locking and stiffness of opening throughout the day. That's a severe cases. And one of the way actually for you at home to figure out if you might have trigger finger, palpate in those areas, and you will notice where you have the trigger finger, there is more inflammation. You might notice more fibrotic tissue thickness. The thicker those tissue, the severity indicative of the trigger finger. I will leave a link under this video sharing the 6 surprising causes for trigger fingers, and also I will leave another link for the 3 most effective approaches to fix trigger finger pain at home. If you have any question or comment, leave it in the comment section. I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to astrinstitute.com.